everyone, Dr. Jeff here. Today I have Michelle here, our resident kinesiologist, and we're actually going to talk about falls and how important falls are. So what is it? Why do we have to talk about falls for?
Well, falls are really important to talk about, especially for our senior population, since unfortunately 62% of injury-related hospitalizations are due to falls for seniors. So, and even more scary than that, 90% of hip fractures actually are because of falls. And the stat that scares me the most is 20% of those hip fractures actually will pass away within the year. So it's really important that we talk about how you can prevent falls before they even occur, because once that fall happens, that injury happens, a lot worse can progress a lot worse.
So when you fall, what other things can happen to you if you have a fall?
Well, the thing is that even if, let's say, you fall and you don't fracture anything, even if you don't sprain or strain something, which is also very common, it really shakes your confidence. So seniors find that when they do fall, they're timid about going out, and they're not as excited about going out and about because they're afraid that fall is going to happen again. So you'll find that seniors no longer get that activity that's really good for healthy living, and so with that, muscle will decrease. There's more of a chance for osteoporosis. If there's more of a chance for osteoporosis, that means next time you fall, it's more likely you're going to break or strain something. And on top of that, if you're not going out, you're not socializing, and depression might occur as well. So it's really important that we prevent the fall completely.
So wow. So how can we prevent falls, especially falls in your home?
That's a great question, actually, because unfortunately 50% of falls actually occur at the home. So it's important that you take a critical eye to the rooms in your home. So whether it be your home or your parents' home who may be aging, it's important that you look at it, see if there's any kind of slippery floor, make sure that slippery floor is dry, place mats in so that you have a little bit more stick to it. Make sure that you have railings by the stairwell or by the bathtub so that you have a grip hold for it. Making sure carpets are tacked down so that there's less tripping hazard, as well as making sure it's decluttered, that there's no tripping hazards that way. Those are really important things that you can do around the home. And
I have a number of patients come in and they have fallen going out for a walk. What kind of things do you look for outside of the home to make sure that you stay upright?
That's a great question. Also, what you can do is make sure you have the right shoe on. I mean, you shouldn't be going out in slippers because you can easily slip, especially with we live in Canada, so it's very slippery outside in the winter. So making sure you have that right shoe wear. Checking with your doctor about the medications you're on, because there are quite a few medications that might make you feel dizzy or lightheaded. If you have high-low blood pressure, it's something to check out with your doctor as well. Making sure that when you go upstairs, there's nothing on it, so make sure it's decluttered so that you don't have any tripping hazards up and downstairs, which is important. And I know that everybody likes to, or well, some people like to go out and have a drink every so often. Really understanding your cap and making sure that you limit the amount of drinks that you have, because if you get a little bit have a couple more drinks than you should, then it's more likely that you might fall as well. So putting a cap on those drinks. So those are some things that you can do outside.
Great. Thanks for all that information. That's great. I'm Dr. Jeff, and we've been talking with falls here with Michelle, and we have a link you can link on to from the OCA as far as looking into your house and surroundings to see how you can look and declutter and prevent falls. So I'm Dr. Jeff here with Michelle, and I've got your back.